So if we're going to try and help get your knee straight, this gentleman here has volunteered for us to look at his knee. This is the first appointment we've had since the operation earlier in the week. This was an arthroscopic operation, and we're now going to look at trying to get the knee into full extension. So if the knee was lacking extension, as this knee is, because we can get the hand underneath it, it's very important to get the knee extension and the full straightening of the knee back as quickly as possible. So the first thing we do is do passive extension. So at home you can prop your heel up onto a block. Now the back of the knee is definitely suspended without any support whatsoever. So this will now, after a while, allow the muscles and the soft tissues at the back of the knee to passively pay out, and therefore the knee will drop back naturally into a straighter position. We generally suggest that you do this for about 20 minutes, 25 minutes, something like that, but not much longer than that. Then have a period where you bend the knee again and allow the leg to move around a little bit. You don't want to leave it there for over an hour, because it could then become a little bit uncomfortable at the front if it's in hyperextension for too long. Also, you can try to mobilise the knee back into a straight position. So you may have a partner or a spouse or child or something like that you feel confident to let them have a go at this, and just either side of the kneecap you can just gently oscillate the knee down. Now we've taken the support from under the heel so that the patient is confident that the knee's not going to go too far, because now the back of the knee is coming into contact with the bed. So this is just mobilising gently the knee back into that little bit of extension. The reason why it's difficult to get the knee back in extension is we spend so much of our day with the knee in a bent position. So we sleep slightly flexed, we obviously sit with the knee bent, drive with the knee bent, work with the knee bent a lot of the time. So the opportunity to fully straighten the knee is minimal in your day, and it's a very important function to get back of the knee. When the knee is fully straight, the ligaments of the knee joint are in a fully tightened position, what we call taut. When the knee bends slightly, then the ligaments of the knee slightly relax, and that allows us to bend and rotate the knee. When the knee does go fully straight and locks back down, the muscles can then relax and the kneecap can then move around, as we can see here. And that's an important function, to give the kneecap some respite so that it's not constantly compressed between itself and the femur underneath.